Hi Jack, how are you feeling today?
Okay.
Okay, the CT came back and it did confirm that you had an ischemic stroke on the left side of your brain, which explains your right-sided weakness that you're having, okay? Do you have history of smoking?
Yes.
How much do you smoke?
About a pack a day.
A pack a day? For how long?
About 10 years.
10 years? Okay. And what's your normal diet like?
I have a lot of takeout and frozen microwave.
Frozen meals?
Yeah, frozen meals.
Okay.
Sorry, I'm a bit disoriented.
Yeah, that's understandable. Can you squeeze my hands for me? My 2 fingers? Okay.
I'm having a hard time on the right side.
Yeah, which is expected with that stroke. When was the last time you had a bowel movement?
It's been a few days.
Few days?
Mhm.
Okay, that could be because you're mostly in bed now. It's not directly related to the stroke, but because that you are living a more sedentary lifestyle, your bowels aren't as active because you're not getting up, moving around, drinking as much fluids as you normally would on a day-to-day basis. So I'm going to go ahead and take a listen to those, all right?
Okay.
Maybe get you some Miralax ordered or something. Just breathe normally for me, okay?
Okay.
Okay. And it does sound like you might have some constipation, okay?
Okay.
So I'm going to order some Miralax for you and I'm going to let the nurse know. And are you having any nausea or vomiting?
Yes, I have.
Okay. How often?
It's been about once a day.
Once a day? Okay. I'm going to go ahead and order some Zofran PRN for you. So whenever you get nausea or feel like you're going to vomit, just go ahead and ask your nurse if you can have that medication, okay?
Okay. Thank you.
Okay. Yep. Is there anything else I can get you right now? Any questions?
No, I'm good.
Okay. I'll get the nurse in here for you. We got a good team working with you today, all right?
Okay, thank you. Appreciate it.
Yep.
I know.
Hi.
Hello, Mr. Jack. My name is Taylor. I'm going to be your nurse today, and so I'm just going to be giving you guys a little bit of education about administering enteral feedings for when you head home. So I'm going to make sure your bed's locked and film in.
So he'll get to go home soon?
Yes, he will be being discharged soon. We're going to give you guys some education about his medications and how to administer feedings and things, and then he will be discharged within the week.
That's
So,
good.
Can you verify your name and date of birth for me?
Yeah, checking out December 30th, 1996.
All right, thank you.
We'll be able to start throwing the ball around before we know it.
I hope so.
All right, and who are you to him?
I'm his son.
All right, it's nice to meet you.
Nice to meet you.
Okay, so you had a gastrostomy tube placed into your abdomen yesterday because you had an inability to digest food and you're aspirating your food into your lungs because of your stroke. So since that you've already decided on the syringe method to administer your feedings, here's some information and some education for that. So once you're at home, before you administer your feedings, you want to make sure that you assess the incision site of where the gastrostomy tube was placed for any signs of breakdown or irritation, because that could be a sign of infection. And then you want to make sure that you wash your hands, and if you guys have access to gloves, go ahead and apply those just to decrease the risk of bacteria. You want to make sure to keep your feedings at room temperature at all times, and make sure that you're checking the expiration date and making sure that the container is intact before you use it. And then you will want to be sitting up for this procedure, so at least 30 to 45 degrees. So you're pretty much laying flat right now, so you're going to want to elevate your head more for that, just to kind of help with the ease of the feeding. You're going to flush the tube with 30 milliliters of water before you administer the feedings to make sure to get any of the old residual out of there. And then you're going to clamp the end of the feeding tube that is closest to you, so don't clamp the end that you're going to be inserting the syringe into, clamp it closest to where it's inserted into your body. Then you're going to remove the plunger from the syringe and attach the tip of the syringe to the end of your tube, and you're going to begin to fill the syringe with the measured amount of formula that the doctor has provided for you. You're going to release that clamp that you had just put on there, and you're going to elevate the syringe no more than 1.5 feet above the insertion site. So You don't want to keep it really high in the air because that could cause problems, but if you do want the feedings to speed up a little bit, you'll just raise it slightly. If you want to slow them down, you're going to lower the syringe down. You don't want to administer them too fast because that can cause problems with nausea and some abdominal discomfort for him. So you just want to allow it to empty by gravity. You don't need to push the syringe in or anything, and just repeat those steps that I said before until all of the prescribed amount has been administered. The gravity will decrease risk of nausea and those problems with administering it too fast that I was just talking about. So it should take about 15 to 20 minutes to administer all of it. Okay. And then you're going to want to make sure to flush the tubing again with 30 milliliters of water to get rid of all that extra and make sure that all of it gets inside of the tube. So after, detach your syringe and go ahead and clamp it off again. And then you're going to want to sit up for 30 to 60 minutes after you administer feedings to make sure that you don't have any nausea or aspiration of that feeding as well. So some just things you need to do every day. Make sure to clean your insertion site daily to keep it free of bacteria. You want to clean it with an alcohol swab. You're going to want to monitor your weight daily, and if you gain more than 2 pounds, that's probably an indication that you would call your provider if you gain more than 2 pounds in 24 hours. And then monitor your intake and output just to make sure that you're getting enough put in as well as getting enough out to make sure that your fluid balance is equal. And then some complications you might see, if your feeding tube gets clogged, you might want to attempt to flush it with water. And then if that still doesn't work, call your provider. If you have diarrhea more than 3 times in 24 hours, notify your provider. And if you develop any nausea, vomiting, or you aspirate the formula because it was administered too quickly, you're going to want to place him in a side-lying position, and they're going to provide you with some suction equipment, so you'll want to suction his airway and call the provider immediately. And so at this time, I do want to be sure that I explained why these tube feedings are necessary. Can you tell me why you're getting these tube feedings?
Yeah, so from what my understanding is that I'm choking on my food and I'm having a difficulty swallowing.
Yes, and so it's important, since you're unable to eat solid food, that you get all of those nutrients into your body. So this is a slightly long-term feeding tube, so you'll have it for probably a couple of months. However, we are going to work with you so that eventually you should be able to get the tube removed and return back to a more regular diet after this. So do you guys have any questions? I do have some papers here with all of that information on it.
Because that's a lot of information. So
I also have provided my phone number and the provider's phone number if you guys have any questions or any problems at that time.
Sweet, thank you. I'll let Mom know about this too.
All right.
Thank you.
Thank you. I'm going to send in another nurse here shortly to talk to you more about those medications that you're going to be receiving as well.
Okay, thank you.
All right. Thank you.
Thank you.
Okay.
Hello, my name is Christy. Can I just have you verify your name and date of birth?
Yeah, my name is Jack Howard. I'm born December 30th, 1996.
Okay, looks good. And who do we have here?
This is my son.
Okay.
Hey.
Well, I'm just gonna go ahead, and since I've phoned in and locked your bed, I'm here to explain the medications you'll be sent home with, okay?
Okay.
So we have Zofran for any nausea. You might experience nausea as you start your formula feedings through your gastrostomy tube. So the order states that you'll take 4 milligrams by mouth every 6 hours as needed. You're going to go ahead and administer these medications via your tube, just so we don't aspirate on them. Another nurse, Jessica, will be by later to explain how to properly prepare and administer medications that way, okay?
Okay.
So your medication for the nausea, your Zofran, this can be taken on an empty or full stomach and should work in about an hour to an hour and a half after administration.
Okay.
And you may want to look out for common adverse effects, including constipation, diarrhea, drowsiness, fatigue, headache, or malaise, okay? Do you have any questions on that one?
No.
Okay, so then we'll go ahead and move on to talking about the Miralax. The stroke you experienced may have also caused decreased GI motility in addition to the other complications you're facing.
Okay.
So this is something we want to avoid, especially as we introduce your feedings through your gastrostomy tube, because both of these variables place you at risk for constipation. So the Miralax is ordered for 17 grams by mouth daily to promote regular bowel movements. It'll come in a powder form, which you'll just mix and dissolve in about 4 to 8 ounces of water, okay? You'll administer this through your tube as well, just so we don't aspirate. And you should feel the effects of the medication within 1 to 3 days of administration. So since you have your right-sided weakness and may experience more urgency, we want to make sure that we're keeping in mind safety at home. So just having someone to assist you to the bathroom, handrails in the bathroom, if we can install those, that would be a good measure as well. So we also recommend administering this medication in the morning, just so you're not awake all night, getting up to go to the bathroom.
Okay.
That would help you as well too, if
Yeah.
you're
I don't
helping
wanna
to take
get up.
care of him.
Help you to the restroom when I'm
You're gonna have.
asleep. Alright, whatever.
Okay, we also want to make sure that you have adequate fluid intake throughout the day, just so we don't get dehydrated, and make sure the medication works properly. And common adverse effects might be diarrhea, flatulence, and nausea. Hopefully the Zofran can kind of combat that nausea, but if you have any questions, comments, concerns at any point, just contact your provider.
Okay.
I also have these medication information
Okay.
printouts for you. Do you guys have any questions at all?
No, I think really well, thank you.
You're welcome. I'll send Jessica in here in a few minutes. You look like you're kind of tired. Do you need to rest?
Yeah.
Okay, I'll send her in just a little bit to kind of explain medications through your gastrostomy tube. Okay, are you both doing okay?
Yep, think
All
so.
right, well, I'll head out then.
Thank you.
No problem.
Hello.
Hi.
How are you guys today?
Oh, pretty good. Want to get out of here,
I
right?
bet. My name is Jessica, and I am here. I'm just gonna get behind you. I am here to tell you how to administer your medication through your tube that has been recently placed. Could you go ahead and state your name and date of birth for me, please?
Yeah, my name is Jack, and I was born December 30th, 1996.
Perfect. Who do we have here today, Jack?
It's my son.
Oh, nice to meet you. What's your name?
Dominic.
Very nice to meet you, Dominic.
Nice to meet you.
All right, so nurse Christy came in and explained that you are taking Zofran and Miralax for nausea and constipation that you might get from having your tube placed in,
Mhm.
right? Okay, so what we want to do, since you'll probably be helping him administer the medication, if
He
you
will.
would want to go ahead, I'm sorry?
He will.
Okay, so it's all on you.
Yes.
Right? Okay, so what we want to do is you want to go ahead and wash your hands and put on some gloves because we don't want to contaminate the medication that you'll be touching. Since Zofran comes in a tablet form, you're going to want to crush it into like a fine powder and then dissolve it in 30 milliliters of water.
Okay.
Um,
What can I use to crush it?
So we can either provide you, it's called like a pill pulverizer, and you'll
Oh,
just put
okay.
your pill in there and just scrunch it up or twist it until it gets into a powder
okay.
form. Or Walmart and Walgreens, they also, you can buy that online or you can go to the store and
Oh,
the
sweet.
pharmacy there could probably
Okay.
help you with that. So after the Zofran is dissolved, you want to make sure to, when you're preparing the Miralax, if you're going to give them together, that you don't combine the two medications together because they could interact with each other.
Okay.
So to prepare the Miralax, I'm sure Nurse Christy already said it, but I'll go ahead and reiterate that it's 4 to 8 ounces of water to dissolve your Miralax for you fully. So once you have everything ready, you want to make sure that he's elevated at a 30 to 45 degree angle, or if he prefers, he can sit in a chair and like watch his favorite TV show or whatnot while we're doing this.
Okay.
Okay, and we're going to give you an oral syringe to administer the medication. You want to make sure you only use that syringe and not any other one, so that way we know that you're giving the proper amount.
Okay.
Okay, first you'll want to go ahead and draw up about 30 milliliters of water and you're gonna want to clamp his tubing just like you would when you do his feeding,
Mm-hmm.
and you'll want to flush his tube with that water. So you'll just get your syringe and just flush it out, just to make sure that we clear anything that could be blocking that tube.
Okay.
So we're gonna do what's called a gravity method. So we're gonna let gravity do its course, so you don't really have much to do.
Oh, sweet.
Okay, so let's pretend this is our syringe. You're gonna take the plunger out. You're gonna take your first medication, and you're gonna, sorry, scratch that. You're going to place the syringe in the tube. With the plunger out, you're gonna get your medication and pour it in.
Okay.
Okay, and then you'll just leave it alone. Gravity would do it. If you notice that the medication is not flowing in, you can either raise the syringe up, so that way you have a little bit more gravity working on it, or you can move your dad around and see if that helps out. So once you've finished with that, you're going to want to go ahead, put the plunger back in, get another 30 milliliters of water, and flush that tube out to make sure everything goes in there.
Okay.
And then you can do your next medication. And then you'll do the same thing. Take the plunger out, put the medication in, do what works best, and then put the plunger in, fill it up with water again, and flush it out to make sure everything gets out of there. One thing, if you do notice while you're doing this, that whenever you move it around and it's still not going in, you can go ahead and get that plunger with the medication in and try to push it in and see if that works.
Okay.
If you do feel resistance with it, you're going to want to stop administering and call your doctor and let
Okay.
him know that something's wrong, something's happening, I can't get the medication to go in. Sound good?
Yep.
Okay.
And you mix. I know the Miralax is mixed with water, but
Mhm.
you mix the Zofran with the water too, or you mix it with-
Separately, yes.
separately.
Yeah.
Okay.
Mhm. So you have your Miralax in one cup, and then you have your Zofran in another cup
Zofran with the water.
with the water.
Okay.
Correct.
Gotcha.
Yep.
Yep.
Yep. Okay. And when you're done with the medication, if doctor said that you can unclamp the tube and let the feeding start again, you can go ahead and do that at that time. Then you can get him all comfortable. Make sure that he stays elevated for at least an hour, just to make sure everything is settled.
Mhm.
And then you'll just want to discard your gloves and wash your hands, and you'll be done.
Cool.
So what you want to watch for is if he has any, if he knows any choking or gurgling noises that he's making, and then just give us a call so that way we can see you guys and see what's the problem.
Alrighty.
So do you understand why we're administering the medication this way?
Yeah, just because of his right-sided weakness of his face, he can't really swallow anything. So
Mhm.
I'd hate to see him choke.
Right, this is true. Okay, do you have any other questions for me at this time?
I don't think so.
All right, Jack and Dominic, it was nice meeting you.
It's nice meeting you. Thank you.
Have a good day, guys.
All right, you too.
Thanks.
She was nice.
She was